Erik van Muilekom, President of the European Oncology Nursing Society, EAUNS. Can you tell us something about the relationship between nursing care and patient outcomes?
As a president of the European Oncology Nursing Society, I'm very happy there is more and more proof, also in the literature, that there is a very strong relationship between patient outcomes and the amount of nurses, specialized nursing, working in a specific area. I must say for myself, I know that already for 35 years. I think that's the time I'm working in this cancer field. But now it's already stated a large European study where they have seen that there is a relationship between specialized nursing and mortality for patients. So if you go under a certain amount of nurses in your inpatient clinic, it will have effects on the outcomes and mortality. So that's really an important point, I think, and that's also a message we have to give to other healthcare providers, that it's important to have specialized and well-trained nurses on your wards and wherever they work, because that will have effects on, finally in patients' outcomes also.
What do you think about the concept multidisciplinary teams?
Multidisciplinary teams nowadays, it's very popular to call it like this. I think it's a good way to go. It's the only way to go. I think but I would like to call it a little bit differently, because I think it should be multi-professional. Multidisciplinarity means more or less multi in one profession, and that's nowadays it's the doctors, of course. And in care also nurses are involved, but also dietitians, for example, or other kind of healthcare professionals. So I think we should call it multi-professionality. That would be good.
What actions are undertaken by EAUNS to improve the position and quality of advanced nursing care?
As EAUNS, as an organization, we're already working for 10-15 years, I think, to improve nursing care for nurses. And what we recently have been publishing is the new curriculum for oncology nursing. That's a curriculum made specially for Europe, so that all individual countries can use that for their own education, and to make sure that the level of education for all nurses is more or less the same. That's one point. On the other hand, we're working on recognition for oncology nursing in Europe. We're doing that with our partners in ECHO, our partners ESPO and ESTRO, for example. And I know also for them it has been a struggle to get that recognition, but we really think it's important to work on that. So we've got more or less one standard in care in Europe. It's even more important because we see there will come on a shortage of nurses in the next few decades due to people leaving the profession because they're not recognized for what they do. Low salaries, for example, that's one of the other points. But there's an increase of demand, because we're getting more and more older people, and a lot of people getting cancer, of course. We all know that. So the demand is increasing. But professionals are going away out of that profession. So that's really a problem, and that's what we think we have to do something about that. And as EAUNS, we think recognition would be one of those items to work on, to make sure that those people who work in that area stay in that area. Another point is that if you look into nursing care and advanced care, you see that sometimes nurses can do work which nowadays is done by physicians, because also there will come a shortage of physicians in the next decades. So if they work more together, we can make sure that nurses will stay in their profession and develop their roles in cancer care. It can be very cost effective also. And that they can really work together in multi-professional teams with physicians to improve cancer care. And that's where this is all about, I think.
Okay, thank you very much for this interview.
Okay, thank you very much.